Hey guys, it's Haylie Pomroy, your nutritionist, and I'm here in my clinic today, and at the end of the day I like to kind of take some time to think about the day, also answer my client emails, and this one is going to require me to fill out what we call a request for care here in our office. But you guys all have access to this. If you're members, you have my actual sheets that I fill out with my clients if you're members to the website, but don't worry about it. If not, we've got the Dear Dr. Sanders letter here in the book, which is on page 258, and this shows you how you can create your own request for care. So one of the things that I do with all of my clients in my offices is that we always talk about being the best advocates for your health and wellness. And part of that is partnering with doctors, chiropractors, acupuncturists, neurosurgeons, infectious disease doctors. We want to create a partnership so that we create the best health team for you. So I got a great email at the end of the day at clinic, and I wanted to take you through how I take that email and I help create a request for care because she's getting ready to go in and see her doctor. So let's go through this process. If you guys aren't members on the website, go to page 258 of your book and look at the Dear Dr. Sanders letter. My request for care that I use for my clinic is built after that Dear Dr. Sanders letter. So based on my client's email, they're getting ready to try to get pregnant again. And I'm going to take you through with what her email said, how we create a letter to walk into the doctor's office. My clients always walk in with a note for their doctor that they give a copy to their doctor, they keep a copy for themselves, and if they're going in to have labs run, they take a copy with them to the phlebotomist or where they go get their blood drawn and make sure that that person checks the lab requisite and that everything's run that they request. Because remember, most of the time they save your blood for 5 to 10 business days. So for example, if you're requesting an FSH or a TSH or some sort of a thyroid hormone and they didn't get it run in the very beginning, you want to make sure that that phlebotomist checks and then they can contact your doctor and have it added to your requisite. So this client has been a client of mine for a long time. She's super savvy. And we've created her health wish list. We know we do her self-assessment quiz. And so you would do a self-assessment questionnaire on page 44, which gives you an indication of kind of what's going on in your body, and your health wish list, which is what you desired. I'm going to show you how we're going to put this all in here. So this request for care, you can download it in the member part of the section if you're in there. If not, you can create your own based off of the Dear Dr. Sanders letter. But what we're going to do is, I'm going to go through this with you. I'm having some health issues that are very concerning to me. In addition to the normal labs we would run at this visit, can we please run some additional diagnostics so that we can help define what is going on with me? Notice I always use the word we. This is about creating a team and a partnership. You are the specialist in your body. Your physician has gone to school for so many years simply to be in service to you. You guys are a team and a partnership. The reason I'm requesting these is because I am experiencing, and this is where my client laid it out for me in her email because she's been super trained by me over the years because we go through this process. You will do this from your self-assessment questionnaire. So let me tell you things that because she's experiencing irregular periods, she's expressed in her email that she's having heavy bleeding. She's also having hot flashes. She's also noticing symptoms of her thyroiditis, such as edema, swelling, and a sore throat. So this client has in the past been diagnosed with Hashimoto's, and you guys can go to my website. I have a whole blog on how to test for thyroid conditions, also autoimmune conditions. The autoimmune section of FoodRx, this book talks a lot about the autoimmune disorders that we call thyroiditis or Hashimoto's thyroiditis. So all that information is accessible to you too, as well as there's a whole definition guide here for you guys that talks about what labs to run and why and when, and there's one in each chapter. So also please note, so this is where you state your health goals. So she wants to say we are wanting, they're ready to get pregnant again, to get pregnant again. And I will say some of the concerns with this, again, is their irregular periods, but also the first time they came in and we worked with conception, the thyroiditis was really flaring, and that immune response can inhibit sometimes a complete ovulation. So we want to let the doctor know what her health goals are. We're wanting to get pregnant again. Also, something notable is that she is 40 years old this year, and that's notable from a fertility perspective, but docs don't always have the time to look at that, so you always want to state something that's notable, that they're going to go, oh, that's interesting. Also, I am 40 this year. And this will be exactly what she walks into her doctor's office. So because of my periods, I would like to run, and this is where you're going to pull it out of your chapter. We want to run FSH, TSH. Actually, we're going to run FSH, E2, which is the estrogen, progesterone. I don't have my cheat sheet in front of me like you guys do. Testosterone, free and total. And this is going to help us give an indication how her fertility hormones or her sex hormones are, okay? And again, she's already stated that she's having some issues with her periods. Because of her thyroiditis diagnosis, you guys have your cheat sheets. We're going to put the TSH, T3, T4, total and uptake, anti-thyroid antibody, and thyroid peroxidase. So again, if you guys, after you define what's going on specifically with you, when you state your health goals, you're going to be able to fill these out so simply. And then she's just going to sign this and she's going to take it to her doctor's office. It's that simple. So remember to look at your Dear Dr. Sanders letter. If you're a member, you have a sample sheet of one of these. In the book, you fill out your questionnaire to find out what's going on, which is this section. You state your health wish list, which is this section. And then specifically, you're going to want to ask for the labs that you want. Take a copy with you. Give a copy to the nurse. Take a copy to the lab. And always remember, a prepared patient gets much better care.